Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video lecture we are going to see another mineral test, that is the chromium blood test. If you guys remember, we already talked about different mineral test, like we talked about sulfur test, iodine test, okay, magnesium, copper test. So if you miss this video lecture, there will be a playlist into my YouTube channel. The playlist name is the electrolyte and mineral test. So then you will find all the lectures. Okay, so today in this video we are going to see the chromium blood test. So my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Let's start the video. In this video the main content is first of all we are going to see that what is chromium, function of chromium, diagnostic purpose of chromium, test procedures, normal range, and main cause of high and low chromium. First of all, let's see that introduction of the chromium. So chromium is actually the essential and trace element in humans. It means that it is found in a very trace amount, in a very less amount in human body. Okay, chromium is actually the minerals and it is denoted by Cr and its atomic number is 24. Chromium is also found in food, but in a very low amount, like whole grains, fruit, vegetables, meat, dairy products. Chromium, if we talked about function of the chromium, so it can regulate the blood sugars, it can metabolize carbohydrate, fats and proteins, it can produce the energy, it can also maintain the weight, moreover it can support the heart health. So this is the structure of this is the chromium, physical structure of the chromium. If you see, so chromium will be look like in this form. Now let's see the diagnostic purpose of this test. So this test is especially used to detect the chromium deficiency. This test is used to evaluate insulin resistance or diabetes disease. This test is especially used to monitor chromium toxicity that can cause cancer. This test is also used to examine the chronic kidney disease. This test is also used to check the treatment efficacy. The test procedure is very simple. First of all, you need to take the blood from the vein and collect it into the gel tube red top. Once you collect the blood, then you will centrifuge it to separate the serum. The separate spelling is the spelling is not correct, so you will correct the spelling by yourself. Then we will run this test on advanced machine like Mendray, Selectra, etc. The normal range of the chromium is 0.2 to 0.6 microgram per liter. Let's see the main cause of high chromium. So it is due to the environmental exposure. So when we are exposed to contaminated, let's suppose we are drinking contaminated water, building contaminated water, soil, etc. So it may increase the chromium in your blood. Due to chronic kidney disease, due to respiratory, we can also say that high chromium may affect the respiratory problem like lung damage, asthma and respiratory tract irritations. High chromium may also cause skin issue like dermatitis, skin ulcer, allergic reactions. Due to high chromium there will be liver damage and cancer risk. Due to high chromium there is a gastrointestinal tract issue, like we have nausea, vomiting and abdominal pain. So this is all about the chromium test. Thank you so much for watching this video. If you like this video, make sure to hit the like button, share this video and subscribe the channel to get more interesting videos like that. Thank you so much.